Hello, I'm Dr. Diana Chavkin here at SCRC Fertility in Beverly Hills. We are doing an IG Live today, and I'm going to talk to you about something that people ask me a lot about, and I think that this is often a source of confusion for a lot of people, and so I wanted to kind of talk about it today. So we're going to talk about the timeline of an IVF cycle and also about an egg freezing cycle. But I also want to tell you that this is really open for questions. So this is your time to just really ask me anything, and I'll try to get to as many questions as possible. But please note that if I don't get to your questions, please feel free to reach out anyhow. I'd love to speak with you during a consultation if we don't get to your questions here today. But basically, so the idea of talking about the timeline is that a lot of people don't realize that the egg freezing cycle and the IVF cycle really don't have to take over your life for huge chunks of time. There are kind of discrete points of time that are kind of locked in, but when we talk about the overall process, I think it's really important to understand the specific discrete steps. So if somebody comes to see me and they're interested in an IVF cycle or an egg freezing cycle, first of all, we have to do the workup. So we need to make sure that labs are updated. So infectious disease testing, hormonal tests. I'll often recommend that we get a genetic carrier screening test. So that's a blood test where we assess whether you are a carrier for specific autosomal recessive disorders. Very important if we're going to do an IVF cycle and create an embryo, because we want to make sure that your sperm source was not a carrier for that thing, and if they were, then we potentially talk about testing the embryo for that disorder. But essentially, this is kind of all information we need to know at the outset prior to beginning stimulation. Whether you're doing an IVF cycle or an egg freezing cycle, I'll want to get an AMH level. That's a measure of your ovarian reserve. And we'll want to do a follicle count. That's where I'll do an ultrasound and look at the little black circles on the ovary. That gives us an idea of your overall resting ovarian reserve and fertility potential. So once we get all of that completed, we're usually ready to start the process. Now, when somebody reaches out with their period and they come in for a baseline ultrasound, a lot of times I will put women on birth control pills. Now, we don't have to put everybody on birth control pills, and it's a conversation I have with people, but I often do find that we get a more synchronous response to the stimulation if your hormones are suppressed before we begin the stimulation. See, your brain is secreting gonadotropins, hormones, to stimulate your ovary to produce follicles. Now, if your hormones are being produced by your brain to stimulate your ovary, and then I give you hormones to stimulate your ovary, sometimes there's a crosswire, and there's different messages that are being sent to the ovary, such that when you're undergoing stimulation, we don't always get a nice synchronous response to the stimulation. And what that ultimately means is that when we do the egg retrieval, we don't get as many mature eggs as we would have otherwise. So birth control pills can really help in that way. So again, we don't have to use pills, and it's a conversation I have for each individual person, but oftentimes I will use birth control pills. And the birth control pills can be given anywhere between 10 days, 2 weeks, sometimes 3 weeks. And we can alter the amount of time that you're on the birth control pills depending on your blackout dates. Meaning if you have dates that you have big work things or vacations or whatnot, you're out of town, we can make sure that you stay on the birth control pills until you're ready to be here for the process. And so essentially, it's, as I mentioned, it's the workup, it's birth control pills, maybe not birth control pills, but if you are on the birth control pills, it's essentially the stimulation process starts about 5 days after your last birth control pills. So then the process is essentially starts either, again, with your period or after you've been on the birth control pills. The process, again, whether it's egg freezing or IVF, is essentially where you will take injections for a period of about 10 to 12 days. These are subcutaneous thin small needles that will have you self-administer. And you take those hormones in the form of those subcutaneous injections for a period of about 10 to 12 days. And it's during those 10 to 12 days that we really, really need you here and in town. So that's that discrete point in time that we need you around. Because what's going to happen is you're going to take the injections at home, but then you're going to come in to see us for what we call monitoring visits. So this is blood work, ultrasound, where you come in to see us for those tests. And usually it's about 3 to 4 times during that 10 to 12 day period. but then we'll get those results, and based on those results, I will tweak your medication dose. Sometimes I'll increase your dose, sometimes I'll decrease your dose, and then I'll determine when to bring you back. So sometimes it's 2 days later, sometimes 3 days later, to again check in to see how you're responding to the medications. We then get you to the point of the egg retrieval procedure. So that's about 12 days after you first started the injections. The egg retrieval procedure is performed under anesthesia. You're asleep. We'll get as many follicles, as many eggs as we can. And I would say that is really the only day that you're kind of out of commission and out of work, and that's mostly because of the anesthesia. And then by the next day after the egg retrieval, most people are good to go back to work. So if you're going to do an egg freezing cycle, what happens is we get the eggs the day of the egg retrieval and the eggs are frozen. If you're going to do an IVF cycle, I'll tell you what happens. But what happens is actually what happens in the lab. So for you specifically, physically, there's nothing more that's going on after the eggs are retrieved. So it's really the same whether you're going to do an IVF or an egg freezing cycle. The process of that 2-week process of injections coming in for monitoring and egg retrieval is the same whether you're doing an egg freeze or an IVF cycle. So if you're going to do an IVF cycle, you'll get updates from our labs, but essentially what happens is that the lab will take the eggs, fertilize the eggs with the sperm, create embryos. We'll let you know the day after the egg retrieval how many eggs fertilized. About a week later, we know how many embryos formed. And then if we're going to do PGTA testing, where we test the chromosomes of the embryo, we'll biopsy each embryo, freeze each embryo. The biopsy sample is sent off for testing. About 2 to 3 weeks later, we find out which embryos are chromosomally normal and which are not. And then we have a conversation about what do you want to do next. Do you want to proceed with a frozen embryo transfer cycle? Do you want to leave those embryos for a while, come back to them later when you're ready to have a baby? Or do you want to do another IVF cycle to potentially make more embryos? And of course, that depends on your specific process. So again, in terms of timeline for the egg freezing cycle, from beginning of injections to retrieval, it's about 12 days or 2 weeks, let's say. Same thing for the IVF cycle, but what happens in the IVF cycle is after the egg retrieval, there's a lot more action in the lab. So again, it's about a week after the egg retrieval, we find out how many embryos formed. The biopsy samples, if we're going to do PGTA, are then sent off at that point in time. So about 2 to 3 weeks later, we find out if embryos are normal. And then if we're going to do the embryo transfer, we proceed at that point. The embryo transfer process takes about 2 to 3 weeks. That's where you're taking estrogen and then progesterone. And then on the 6th day of progesterone, we'll do the embryo transfer. So for an IVF cycle, kind of from like beginning to end, meaning from beginning of injections until we do the embryo transfer, it's about 2 months. But that's not including the time that it took for the workup or for the birth control pills prior. For the egg freezing, it's about 2 weeks. Again, not including the workup or the birth control pills. Egg freezing is injections to retrieval about 2 weeks. So that's important to understand. And I think that for the IVF cycle, it's important to understand that, like, if I say it's 2 months from beginning to end, what I think you have to understand is that there's a few weeks in the middle where things are kind of cooking in the lab or waiting for results. So it's not like a full 2 months that you have to be here and available. Really, it's that discrete point in time where you have to be available for the stimulation and then the egg retrieval. Then you just kind of stay alert for updates. And then the embryo transfer, the frozen embryo transfer cycle, it's about 2 to 3 weeks. And so for that, you have to be here as well. So that's, I think, kind of a way to wrap your head around the timeline and the timing. And I think maybe I'll take a pause. And I encourage any sort of questions, because this is really, just time for you guys to ask questions. So one of the questions here is IVF safe for mild kidney disease women? So for mild kidney disease, yeah, it usually is safe, but I would have, and this goes for really any sort of chronic medical issue, condition, I would want your kidney doctor, so your nephrologist, to kind of comment on this, do an updated evaluation, and write me a thorough clearance letter saying that it is safe for you to undergo stimulation and the IVF process. The other thing is that I would also want, if you had any sort of chronic medical issue, I'd want a consultation with a maternal fetal medicine doctor. So a maternal fetal medicine doctor is an OBGYN who specializes in taking care of women who have chronic medical issues. And so they give assessments in terms of how your disease might affect your pregnancy, how it might affect your health during pregnancy or your baby's health during pregnancy, how that disease might or might not get exacerbated during pregnancy, and so it's sort of important to go over all of those risks and issues. And also there are sometimes recommendations from the MFM to me to tell me, as your GYN who's taking care of you before you get pregnant, what are some of the things we should do to assess you before you actually get pregnant, so that they can come in and give clearance and make sure that it's actually safe for you to not just undergo IVF, but actually to get pregnant. Okay, so hopefully I answered that question. Let's see, do I have any other questions here? Good, lots of people looks like joined, so happy that you're here today. But yeah, like I said, I do welcome questions. You're welcome. I'd say a lot of times people ask me kind of, what is it like to undergo, the IVF stimulation, and how is this going to affect my work schedule and my life? And also same for egg freezing, right? So, I think usually, really the only day that people have to take off from work is the day of the egg retrieval procedure, mostly because of the anesthesia. You can't really go back to work. You actually can't leave our facility unless somebody takes you home because of the anesthesia. But by the next day, usually people are pretty good to go back to work, especially if they have sedentary jobs. I mean, if people have very physically active jobs where they're lifting things, if they're a postal worker and they're lifting heavy bags, then I'd say maybe, a day or two past that to take off. But usually most people are good to go back to work the next day. And while women are taking the injections, I mean, people really go about their lives as normal. There are very few, I'd say, real effects on people's lives. People are going to work. People usually come in for the ultrasound. So as I mentioned, during the stimulation, you'll come in for monitoring visits. But most of the time, the monitoring visits are done in the morning before work, or sometimes people come in kind of in the later morning if they take kind of an early lunch. But we'll get the blood work, ultrasound, and then adjust the medication, and then we reach out to you with the instructions later on that day. So these are not usually visits that you have to block your schedule for or take off from work for. They're usually 10, 15-minute appointments. We're lucky that we have a facility where we have sonographers who will do ultrasound, and we have staff here as early as 6:30 in the morning on weekdays. And so people really don't find that this process gets in the way of their lives or their work. And then in terms of normal life, I mean, in the evenings, I mean, you do your usual thing. You come in the morning, get your monitoring visits, and it's not every day. It's usually 3 to 4 times maybe during that 10 to 12 day period. But people will come in the morning, get their blood work, ultrasound. We get them their results later on that day. We'll give you the instructions, and then you go about your life. I mean, in the evenings, you can still go out to dinner with friends and go about your life. It's really just the day of the egg retrieval that you're kind of out of commission. Okay, so again, if there are any questions for me, please throw it at me. And if you don't, I mean, I welcome you to reach out separately. Happy to meet with each of you individually. We do have some promotions on discounts on consultations and stimulation going all the way until mid-August. So please ask about those if you call our office. And I think if there are no other questions, I think I'll sign off, but so happy to connect with you today, and wishing you all a beautiful, beautiful day. Thank you.